protein, whole milk, and banana and PB2. I know you
Ooh,
can't. I can't.
nice.
Yeah, I honestly like. I know you can't eat peanut butter, but maybe they'll make like a powdered sun butter one day. But like powdered peanut butter is so nice because I love the taste of it, but sometimes I
Yeah,
just don't want the fats. Like I had whole milk in there, so I didn't want to put like
yeah.
actual peanut butter in there.
Oh, gotcha.
And so we buy like a big tub of like peanut butter powder,
Yeah.
and it's like pretty cheap. It's like $8, and like they say like a tablespoon of powder is like almost close to 2 tablespoons of like actual peanut butter once you mix it with water.
Wow,
Um,
okay.
so it's like a pretty nice, and like with the protein we have like this mocha, so it's like it's like a salty peanut butter mocha like smoothie at the end of the day, which I love salty and sweet. Like I crave salty and sweet.
It's
So
such a good
maybe
combo.
I know. So that kind of leads us to the conversation of episode 69, right? What are we talking about?
We're talking about type 1 and type 2 diabetes today, folks.
Diabetes.
Diabetes.
If you ever watch those memes out there on the social medias, that what I'm talking about when I say diabetes. It's like that big like gray-haired guy. Yeah. And he's got his face all
Still,
red and he's like eyes bulgy.
still to this day, one of my favorite like cartoon clips is the diabetes clip from Family Guy. Do you know that one?
I maybe.
If I don't remember, remind me. But I'll go ahead and send it to you.
Yeah,
It's so
I
funny.
feel like I do. Um, but hey, Roman, just so you know, I don't know if you watched the vlog that I put up of this weekend, but
I
I
haven't. I
did.
started it and I liked it.
So if you guys was familiar with the YouTube channel, I did put up a vlog, but I wanted to say something about it because I'm not trying to promote it as much because this is Gainz podcast. We talk about gains, gains, gains. But in the middle of the clip, I do go over some gains tips and tricks when it comes to hiking. So if you haven't checked it out, check it out. I do go over like a 2-minute spiel about like trekking poles and like walking sticks and whatnot. Also, my dad homemade that stick, Roman. So
No way, really?
so yeah, so shout out to my pops for making that for me. He told me to bring it here because I have trekking poles, but actually, you know what? That was actually sturdier than the trekking poles because maybe I didn't buy the most expensive pair, but they're not as like I guess built for a man that's over 200 pounds.
Yeah. Did you get the Ozark Trails one from Walmart?
No, I got it on Amazon. It's probably almost the
Okay.
same, or maybe
Okay.
lesser. I don't know. I'm not
Yeah.
sure.
Laura got a really nice pair from REI, but I just got a cheap pair from Walmart. They're fine for hiking. They got the job done. Like we one of the hikes we did, the bridge, like the man-made bridge that was created.
It's Terabithia?
Yeah, exactly. It was underwater, so and it like had gotten algae on it, so it was like very slippery. So the trekking poles were so clutch to just kind of like keep steady, and it was good hiking weather, but it was probably like in the upper 50s. So like you wouldn't have wanted to get wet. Like if your whole like obviously my feet, my socks got wet, but like if your whole body got wet, like you would have been miserable for the rest of the trip, just because you wouldn't be able to dry yourself off.
What's worse, hiking with wet socks and shoes,
That's about
or
all there is to know about
or
trekking poles.
or commuting to work and it downpours and you free your umbrella and an extra pair of socks or rain boots and you work a whole day with wet socks?
We're back at it. We're covering
Okay.
episode 69, diabetes mellitus. What is it, folks?
Yeah, what is it, Robert? Do you want me to go into the kind of the definitions first? You want to talk a little
Yeah,
bit what we're going to talk about today, or?
yeah, sure. We wanted to chat with you a little bit about like type 1, type 2 diabetes, as well as gestational diabetes. So it essentially occurs like during pregnancy. And within our scope of practice, what we can recommend insofar as general descriptions of like physical activity, which may be beneficial. It is important to note that if, as a personal trainer, at least under the NSCA, if you do have a metabolic condition, I believe it's required to have some sort of like doctor's note, like notification or notice that's like the doctor essentially gives you a thumbs up to work with a personal trainer. And it would probably be important for the personal trainer to work in network with the doctor as well, and pretty much go over the program that's been designed for the client. So let's say you have somebody that has developed type 2 diabetes. They have a family history of it. They are overweight and are hypertensive, and they want to make some lifestyle changes. And they believe that increasing their amount of cardio that they do in the week, as well as resistance exercise training, so lifting weights, will help them with that. You still need and should get permission or the go-ahead from their doctor to be able to train them before you move forward. So I did want to mention that diabetes, as well as metabolic syndrome, which we'll talk about, are what are deemed metabolic conditions. So they are beyond the scope of program design for a certified personal trainer, barring you have other potentially certifications that specifically work with that population. It doesn't necessarily mean that you can't work that population. It just means you need to essentially be given the go-ahead from a medical practitioner that the program that you've specifically scoped out is within the thresholds of the individual. You don't essentially want to, that's not a client that you'd want to like kind of grind into the ground, like, give me one more rep. I mean, maybe they might need that kind of thing, but, pushing that person to absolute failure on certain lifts could could spike their blood pressure so that they faint and then the weight collapses on them. Obviously not a good thing. Our main priority is safety over anything else. You could, the program design could overdo it and cause the person to be hypoglycemic. So there's a lot of things that could go on. So it's important to get that go ahead from the medical community, of course.
Yeah, and also too, grind time, baby. I mean, we're not leaving the gym until we throw up, we bleed, we pass out, or we can't walk out. So if you guys aren't hitting one of those 4 attributes today, I want you to tune off this channel, because you're not part of our lifestyle, bro.
I hit like 235 for like 15 or 16 or something like that reps on Smith squats this weekend. And after my third set, like I almost puked.
Yeah, I
get like the sick in the belly feeling, and it kind of soiled the rest of my workout. But I still crushed it. But I kind of felt like Mike Israetel. I was like, I'm trying, baby. I'm working on these baby quad gains.
Yeah, and you know what? Sometimes that's okay. I'm talking to like the healthy populations. Like that happens like ever so often. Like probably shouldn't worry about it. But to Roman's point, like all joking aside about like what Roman was talking about, with NASM, in the training with personal training, they actually do go over like some, metabolic syndromes like Roman was talking about, like type 1, type 2, as well as some typical common medications, and what they do to the body before like training. So like Roman said, like, yeah. So like what you're saying about like work with the doctor, yes, do that, as well as like NASM, actually you go through some of the some like commonly used medicine, or like hypertensive medicine, diabetic medication, all that good stuff when it comes to like working out with someone. So you kind of have a good idea, like say if it helps like lower blood pressure, it might do something else. Like so if like you're taking blood pressure medicine, I'm not going to get into that. I'm not a pharmacist. I'm not any of that stuff. So I'm just going to stop there because I don't want to say something wrong. But to Roman's point, yeah, we're going to be talking about those ideas today. Quickly, I'll just go over some type 1 and type 2 if you want me to just go over that general description and definition.
Yeah, I think it'd be helpful because those terms might be thrown around a lot, so it'd be good for people to like hear and understand that, and then we can kind of talk about like what fitness looks like for that individual.
Yeah, and also too, like some of the stuff is like new information for me. My father was diagnosed with type 2 diabetes. I want to say within 5 years or so. So it's pretty recent. So we'll go talk about like a little bit more with type 2, but so pretty much got this information off the mayonnaise clinic. Is that what they're called?
Yeah.
Oh, okay. So no, I'm just kidding, guys. So I made it easy this time. I got one source of information from one source themselves, Mayo Clinic, not the mayonnaise clinic. I think they're coming out with a light avocado mayo clinic.
You know what? I heard that is a spring edition.
You know what? I gotta stop doing that. If Sam Sam doesn't listen to this podcast, but she like hates the sarcasm out of my mouth. So pretty much easy enough. Type 1. It's known as a juvenile. I'm looking over here, so don't worry about it too much. It's known as like the juvenile diabetes or insulin dependent diabetes. Type 1 is usually a condition that happens most likely when you're younger as like a child. That's when your pancreas produces little or no insulin. And then insulin is that hormone needed to allow sugar to enter the cells to produce that energy that we talked about the last episode about carbs and sugar. Type 1, you can always... Yeah, go ahead.
I'd say utilize the energy. I meant to talk to you about that. So like we have to make sure we abide by the law of conservation of energy, which says that energy is neither created nor destroyed. So it's utilized. It's not produced. But that's picky. Yeah.
No, that's fine. No, that's good. Believe me, do that all you want. I don't care. But yeah, so type 1, also 2 can happen later in life. Like Roman and I, one of our good friends, actually does have type 1. I think he got it like after high school or college. Pretty much like, and I'll go through the factors of type 1 on like what like the symptoms are and whatnot. But like there was a point where he was an athletic teenager, early adult, and then all of a sudden like, he was fatigued. He was like, feeling thirsty all the time. And then thankfully he caught it because I think almost something really serious happened. I'm not too sure what. Maybe I should have got that info before saying it, but that it could happen later down the road. But type 1 is usually typically when you're like childhood.
I think I also thought that it was like mostly like gestational that would happen like early, but I was reading earlier that it can happen like it can occur up to 25. I think is like the most common. Like it could potentially happen after that, but that's like a vast majority of cases are before the age of 25.
Yeah, and so like what I mentioned earlier about like the increased thirst and fatigue, there's frequent urination, extreme hunger, and unintended weight loss. That's like some other symptoms they did list. And then moving forward, do you want to say anything else before I move to type 2, sir?
No, it's really good. Yeah.
Type 2. So type 2 is, like I mentioned earlier, my father just recently got within like the last 5 years. By the way, type 1, there's no cure. And then we'll talk about type 2 and then kind of go from there. I just want to throw that out there. Type 2.
Yeah, you need exogenous insulin too.
Yeah.
Yeah. Like through like a pump or something like that.
Type 2 is impairment in the way of the body regulates and uses sugar as a fuel. Utilizes, not produces.
Nice.
Also, this long-term condition results in too much sugar circulation in the bloodstream. Eventually, high blood sugars levels can lead to disorders of the circulatory, nervous, and immune system. As you read as I said earlier, like they do believe, you know what? I don't know if type 1, I don't know if I read that part, but Roman, if you can answer, but type 2, as you read, like as I said earlier, can be genetic, which I was always under the assumption that type 2 couldn't be genetic because it's more of a prolonged disease or like a chronic condition where you cause the damage, but I was wrong. So that's what happened when I first learned my father getting diabetes. And I was like probably 20, 21 years old. So not too serious a training, but serious enough. But, once I learned that, I was like, oh, crap. Like, let me not fall through this path and whatnot. But anything. And then type 2, that's most likely something that occurs later in life. You can get it in your younger ages of life as well. So kind of like type 1, but like Roman was saying, type 1 it typically stops at like, the age of 25 and not so much further on. But yeah, I do have more on this. Roman, do you want me to finish before do you want to add anything real quick?
No, you had some really good notes in there. Family history is and definitely can play a role, but there are typically red flags before that as well. So we'll go over metabolic syndrome and what some of those red flags might be, so that if you find that you might be like in that area, hopefully we can provide some practical things that you can try to increase your overall physical activity. Because physical activity, especially for type 2 diabetes, is one of the more potent mitigating factors for reducing your risk for developing type 2 diabetes or keeping it at bay if you have it already.
Yeah, and then what I wanted to add to with type 2, typically they have almost the same symptoms. Besides, I read a little bit different, which is like kind of it's like it makes sense after like knowing a little bit more about type 2, but slow healing sores, frequent infections, numbness or tingling in the hands or feet, areas of darkened skin, usually the armpits and neck. And then probably I'll probably stop there and let you talk about metabolic syndrome, because then after that we'll probably make recommendations for type 1, type 2, because now we know the definitions, and then we can go over metabolic syndrome as well, and then kind of go from there, buddy.
Cool, sounds good. So thank you. That was all really good. So we want to talk about metabolic syndrome because metabolic syndrome is one of like the cascading like series of events that kind of leads to type 2 diabetes, type 1 diabetes. Either you're born with it or you develop it. You will have to use exogenous insulin. So insulin, by way of either injection through a needle or like some sort of a pump that's like hooked up. I believe it's through to your pancreas, but I'm not 100% positive. But I've seen, I had some classmates back in high school that had like one of the pumps. It'll essentially like people will sit it on like their belt or on their pants or shorts, and it'll have just like a little tube that like pricks into the back, into their back area, their lower back area. Let's see here. So this is a definition I have for metabolic syndrome. I got this from NSCA's Essentials of Personal Training, and the individual who worked up this definition, their name is Majko. So it says, according to Majko and colleagues, metabolic syndrome is a clinical entity characterized by a constellation of metabolically related abnormalities and cardiovascular risk factors, including obesity, insulin resistance, glucose intolerance, dyslipidemia, and hypertension. So as I mentioned, that's from the NSCA's Essentials of Personal Training, specifically the second edition. Now, it was noted that there's been some controversy over the exact definition of metabolic syndrome, but people that develop it are at increased risk for developing diabetes mellitus, as we talked about, so type 2 diabetes, and as well as cardiovascular disease. So that includes like increased risk of like heart attack, stroke, etc. So there was a consensus definition. This is also from the NSCA's Essentials of Certified Personal Training. And so there's a consensus definition for this syndrome, and it's in the third report of the expert panel on detection, evaluation, and treatment of high blood cholesterol in adults, in an executive summary. So they essentially brought out 5 points. So these are things to look out for, or risk factors that they don't necessarily mean that you 100% have metabolic syndrome, but taken in together, any 3 of these 5 characteristics could mean that you do have metabolic syndrome or are at increased risk of developing metabolic syndrome. So that's abdominal obesity of a waist circumference for men greater than 102 centimeters or 40 inches. So that's greater than 40 inches in men, and greater than 35 inches or 88 centimeters in women. So that's the first factor. The second factor is hypertriglyceridemia. That's greater than or equal to 150 milligrams per deciliter, or some labs will provide it to you in millimoles per liter, and that's just mmol/L. It's a 1.69 millimoles per liter. You need to have your blood drawn by a lab like Quest Diagnostics, for example. It's not a shout out to them, but I've used them in the past to verify that kind of a result. You can't just pick that number out of thin air. There have to be labs that are done. So the third factor is a reduced HDL cholesterol. We did talk about HDL cholesterol as a good cholesterol, which goes and essentially like picks up various like fatty acids in the bloodstream. So it's a reduced HDL cholesterol below 40 milligrams per deciliter or 1.04 millimoles per liter in men, and below 50 milligrams per deciliter or 1.29 millimoles per liter in women. And ideally for men, we want to get the I think for women too, we want to get our HDL cholesterol above 60 milligrams per deciliter, and that acts as what's referred to as a positive risk factor, meaning that it can take away a potential negative risk factor for a negative like health outcome, such as like hypertension, hyperlipidemia, that kind of thing. The fourth risk factor was elevated blood pressure greater than or equal to 130/85. That's millimeters of mercury. And the fifth risk factor that they brought up is elevated fasting glucose greater than or equal to 110 milligrams per deciliter, or greater than 6.1 millimoles per liter. So they brought up some numbers that this is associated with a 2 to 4 times increase in the risk for cardiovascular morbidity and stroke. Essentially, I went over this before, but that's like increased risk of heart attack, stroke, etc. So Antoine did bring this up. There are some linked genetic factors. If somebody in your immediate family, your immediate blood genetic family, like your father, mother, let's say uncle, grandfather, that kind of thing, did have type 2 diabetes, it does make it more likely that you'll develop it. It doesn't mean that you will develop it. Some other factors are cigarette smoking, which we don't support on the podcast. A sedentary lifestyle. Movement is actually key to help reduce the likelihood of developing diabetes mellitus. Alcohol consumption, a poor diet, and stress. Alcohol consumption, I would like to say, if it's taken in moderation, I would not foresee it being a high likelihood or increase in the risk. It may still potentially increase the risk slightly, but I think that one of the things, not the only thing, but one of the things that alcohol does contribute to a diet overall are essentially like empty calories, if you will. Alcohol does not have much of like a satiety effect, other than like some potential like gut loading, but you're talking about a lot of booze if that's the case, and you're consuming a lot of calories. A lot of that just turns into adipose tissue. So if you're concerned with like physique sports, power sports, strength sports, you don't see a lot of heavy alcohol consumption in those sports because of how much they impact recovery, how much they impact things like weight management. So is it okay to like enjoy like alcoholic beverage like here and there? Sure. Do I? Not really, to be quite honest with you. I can't remember the last time I had a drink. It's probably been like close to a year. But if you want to have a drink every once in a while, totally fine. I'm kind of straying from the point, so that's enough said about that. It's important to know early intervention that includes weight loss through dietary modification and enhanced physical activity can significantly delay or prevent the development of this syndrome. So those are some of the things that I wanted to go over. I had a little helpful chart that I just broke out into a little workup in my notes. So this is also from the NSCA's Essentials of Personal Training under aerobic conditioning for somebody that is essentially maybe at risk, increased risk of developing metabolic syndrome or has metabolic syndrome. You want to essentially look to increase your aerobic activity to greater than or equal to 5 days per week. They say to maximize your caloric expenditure. I understand what they're trying to say because essentially the main goal that they're trying to put out is to bring down your body weight so that you can reduce some of those lifestyle factors, such as the waist circumference greater than 40 or 35 inches if you're a female, 40 if you're a male. Bring down some of your blood lipids, so you might not be hyperlipidemic, for example. Bring down your blood pressure, which is a byproduct of your nervous system, essentially like trying to pump enough blood to tissues, because blood needs to get to tissues to deliver nutrients, oxygen, etc. But it's having trouble doing that, potentially due to an increase of atherosclerotic pulmonary system. So essentially deposits within your veins and your arteries of things like LDL, things like scarring in your veins, arteries, etc. So you want to increase your aerobic activity to 5 days per week. You want the sessions to ideally be between 30 to 60 minutes per day. One of the things that I noted, why not try 3 10-minute walks like Stan Efferding recommends. A 30-minute walk might be too intimidating for you, especially if you are considered morbidly obese, which I believe is a BMI greater than 35. Then walking might be very, very hard and strenuous on your ankles and your knees. So 30 minutes might be like super intimidating for you. Just break it up into 10-minute blocks and see if you can do 3 in a day as opposed to 1 30-minute session. And that can still have really great results for you. You don't have to climb the mountain. There are some hills that we can tackle first before we build up to the mountain. The eventual goal is to work up to 50 to 60 minutes per day to promote or maintain weight loss. And then they made a note about Vo2 Max. Most people aren't going to really look into this, but I'll mention the note because it's even obscure to me, and this is something that I study. So they mentioned 40 to 75% of your VO2 reserve or heart rate reserve, meaning essentially cardio should be challenging but not feel impossible. So I think you can calculate their heart rate reserve by taking 220 and subtracting your age. So I'm 29, so we'll just say 30 just for the ease of maths. So 220 minus 30 is 190. So you'd want your heart rate to stay between 40 and 75%, I believe, of 190 during that cardio. So it's something to figure. But when you're walking, you can do that by swinging your arms. That can also help. It's been shown to help to have a sport-related effect on reducing low back pain for some individuals. So that's another good use case for it. So some guidelines and concerns. Obesity may limit exercise type. As I mentioned, walking may be very challenging. So switching up your exercise modality might be very beneficial for you. So maybe 3 days walking, 2 days biking, for example. And then initially, what you really want to emphasize is increasing the duration rather than the intensity to optimize caloric expenditure. I have a note here because part of like the whole emphasis on caloric expenditure is necessary. It is, I think, scientifically as well as like personally very important. Let's say you're a personal trainer and you're listening to this for your clients. It is important to reduce the overall caloric intake of somebody that has type 2 diabetes, for example, because obesity may be one of the contributing factors that is resulting in dysregulation of blood glucose in their body. It could be poor diet. It could be a sedentary lifestyle. It could be a number of different factors, as we mentioned prior to. But so I think a caloric deficit as well as maintenance are desired. So maintenance diet where the body weight stays within a relative range, let's say like 2 to 5 pounds, and like does not go above or below that range. That's what essentially like a maintenance diet would be. Physical activity also promotes healthful steps, pun intended, towards healthy bones, just based off of the loading. Exercising the heart and muscles in their intended fashion, as well as create another whole cascade of other benefits regarding like pulmonary benefits, respiratory, among many other benefits, mental health benefits, for example. So a focus shouldn't be just on like how many calories did I burn, but rather how does the exercise feel? Did or do I like it? Do I have a belief in this program or form of exercise that this will contribute to a greater quality of life or increase my overall well-being? Will it be tough? Yeah, of course it will be. But should it be helping you towards a goal? Yeah, of course. So those are the main notes that I wanted to get across and make sure that we brought to you folks.
Yeah, and because time's running out. I want to just throw in type 2, like what Roman was just doing a really good job on is like, like getting the weight down, exercising, getting all those processes in place. But yeah, that's typically like how I mentioned earlier. If you rewind back to like the beginning with type 1 having no cure and type 2 kind of a cure, those are some of the things that are gonna help better the process of type 2 diabetes. It's not gonna kill it completely, but a good example is my father was like over 300 pounds and now he's under 200, like just under. But like, when he checks his blood levels or blood sugar levels, it's, as long as he didn't have like a really like carved up meal or big sugar junk meal, like, they're like on point now. Like he's like his readings are like pretty much awesome. But yeah, and then like, like I do want to mention, like if you're training with a client with type 1 or type 2, make sure, like Roman was mentioned about hypoglycemic people, make sure they always have some sort of, I know we probably mentioned it before, but some sort of like sugar and salty drink or a snack as well in the training session, because some of those people you do have to watch out because if it's strenuous work, then a lot of it's getting taken out and they need to replenish faster than like normal people and all that good stuff. So that have like actual working pancreas and, having the stimulus that they'd have. So
yeah, I'd say having a snack on board, especially like one that's like a sugary snack, is really important. And then just kind of recognizing like some of the signs and symptoms. I don't know if this like gym goer was like type 2 or type 1 diabetic, but I do remember this was years ago. This was when I was still living in Falmouth, maybe like 2015, 2016. No, it was definitely 2016 because I was working at the gym at the time. And I was actually at the gym, like working out with my buddy. And I saw a woman and she was kind of like moving slow and weird, like not at her usual pace on the elliptical. And she ended up collapsing off of the elliptical. And at the time we were like, whoa. So we called like the guy that was working, Joe, and we helped her up and we like moved her over to the like the front reception area, and we got her some like orange juice, and her face was just like totally flushed. She was sweating, but like sorry, I said flushed, but she looked like the blood had kind of like drained from her face. And it seemed like she was hypoglycemic. Once again, I don't know if she had like diabetes and if that was like the cause. But But yeah, I mean, it does pay to like kind of like pay attention to people. If somebody looks like totally off or different or something like that, it doesn't hurt too much to say like, even in COVID times, like, hey, are you doing okay? That kind of thing. It could make a big difference. And, somebody could like, oh, no, actually I'm not, sit down. Like, I actually have diabetes. Like in my bag over there, I have oranges. Can you pass me the oranges? Like that kind of thing. Like, you could really help somebody out by just asking like, hey, are you okay? That kind of thing.
Sweet. Well, great, man. Thank you for all that great information. Thank you guys for tuning in as always. We're on all video and audio platforms, so go ahead and please watch or listen to us anywhere you can find us. Go to our Instagram, DM us, and all that good stuff. We'll see you on that next one. Peace.